Today's video is on contact areas of teeth and their clinical significance. So, when two adjacent teeth they contact with each other, mostly this contact is present on the proximal side of teeth. It can be your mesial side or it can be your distal side. So, this area where these two teeth are contacting with each other is known as contact area. So, the learning objectives of today's sessions are to identify the contact areas of maxillary and mandibular teeth. And secondly, in this video, we will be able to relate the clinical significance of contact areas and abrasions formed when two teeth are contacting with each other and the age-related changes with respect to the contact areas of teeth. Now, starting with clinical significance of contact areas. So, in this image, you can see the open contact area is present between these two maxillary central incisors. It means there is no contact between these two incisors. Now, I will be going to draw an incisive papilla here. So, because of this lack of contact, that incisive papilla is grown, and because of that, there is a little bit of interdental tissue in between the teeth. And what will happen with this open contact area? The food and other debris will accumulate over here, and because of this, patient will be facing gingivitis or periodontitis. Okay, and contact area has a role in to maintain proper arch form. What happens is when we are eating or chewing, the masticatory forces are actually distributed throughout the whole arch from one teeth to another through this contact area. So, the contact area are essential not only for mastication and chewing purposes but also for the health of the gingiva, and if we have contact areas, it will prevent the accumulation of food debris and infection. Where these contact areas are actually located. This is the occlusal view of maxillary teeth, right? So, whenever we are seeing this from occlusal view, the contact areas of anterior teeth, they are located in middle 1/3, somewhere here, and in posterior teeth, they are located at middle 1/3 only, but they are more facial side, right? We will be looking at these contact areas from the facial and lingual perspectives and also from the occlusal perspective of maxillary teeth as well as the mandibular. So, we will start with maxillary anterior teeth, the facial aspect. So, now this is maxillary central incisor. This is also maxillary central incisor. This one is lateral incisor, then canine, and first premolar, right? Now, between two central incisors, it means in midline, the contact area is present at incisal 1/3, right? But when you see the distal aspect of central incisor and mesial aspect of lateral incisor, what is mesial and what is distal? Mesial means towards the midline and distal means away from midline, right? Now, in this contact area is present at junction of incisal 1/3 and middle 1/3, right? Same for distal aspect of lateral incisor and mesial aspect of canine. Again, this contact area is present at a junction, and the distal of canine and mesial of first premolar, this is located at middle 1/3, right? Now see, midline, it means between two central incisors, it is incisal 3rd. Then distal of central incisors, it is present over junction of incisal and middle 3rds. For mesial of lateral incisors, again same thing, it is present over the junction. Then for distal of lateral incisors, it is same junction. for mesial of canine, again junction, and distal of canine, it means between canine and first premolar, it is located in a middle third, right? Now moving to maxillary posterior contact areas from the facial aspect. Okay, so they are located within middle one third. So in this image you can see this one is first premolar, second premolar, first molar and second molar, right? And all of them contact areas are present over middle one third. So in this image, this is for maxillary teeth and this one is for mandibular teeth, right? So from facial aspect, you can see this midline, it means between two maxillary central incisors, it is present in incisal one third. Then between maxillary central incisor and lateral incisor, it is over junction. And between lateral incisor and canine, again junction. Then canine and first premolar in middle one third. Then same for all the teeth, right? Now we will see this mandibular teeth in a further video. Okay. So next is seeing this maxillary anterior contact areas from the incisal view. So these contact areas are centered faciolingually or considered as a equidistant from facial and lingual profile. So what does it mean? So in this image, these are maxillary anterior teeth. So whenever you bisect this anterior teeth from the middle part, these contact areas are present at a middle part, right? So these are equidistant. It means this one is your facial aspect and this one is your lingual aspect. There is same distance present from the facial aspect and lingual aspect for the contact area. That's why it is called as equidistant. Okay, it means equal distance from both the side. Now moving to maxillary posterior contact areas from the occlusal view. So in this, contact areas are slightly facial to line that divides tooth in half from a faciolingual perspective. So this is more evident on premolars than molars, and the contact between first molar and second molar is almost centered faciolingually. Okay, now see in this image, again we are bisecting this teeth in two parts on both sides. So in this you can see contact area between canine and premolar, it is present in middle one third. Between two premolars, it is again in middle one third. But when it's turned to contact area of second premolar and first molar, these are present in middle third but slightly towards the facial side, right? This one is the facial side. But when you see the contact area between first molar and second molar, this is present in a center. It means in a middle one third, right? Now next is location of mandibular anterior contact areas from facial aspect. So in this image we have our mandibular central incisor. This one is central incisor, then lateral incisor and canine. So between these two mandibular central incisors, it means in a midline, it is present over incisal one third, and again between central incisor and lateral incisors, again it is present in incisal one third. Same for lateral incisor and canine. So it is easy to recall your mandibular anterior teeth contact areas, right? So see here, in midline it is over incisal third, then for distal of central incisor, again incisal third, then mesial of lateral incisors, it means between central incisor and lateral incisor, incisal third, between lateral incisor and canine, incisal third, and the distal of canine, it means between canine and first premolar, it is present over middle one third, right? So Now we will see location of mandibular posterior contact areas from facial aspect. So this all posterior teeth are contacting each other within middle 1/3. Okay. See here. Here we have our canine, then first premolar, second premolar, first molar and second molar. And these contact areas are present in middle 1/3, right? Now again we will refer that textbook diagram. See here, these are for mandibular teeth between two central incisors. It is located in the incisal 1/3. Same here, incisal 1/3, incisal 1/3. Then it comes to middle 1/3. Now we are going to see this mandibular anterior teeth from incisal aspect. So these contact areas are centered faciolingually or considered as a equidistant from facial and lingual profile, same as for our maxillary anteriors, right? So in this image, this is our mandibular teeth. So till the canine we have our anterior teeth, right? So when you bisect this teeth in two portion, this one is your facial aspect and this is your lingual aspect, and contact area is present here, right, in a middle third. So it is again have same distance from both the aspect. It means from facial side and from the lingual side, right? That's why it is called as equidistant, same as maxillary central incisors. Now moving to location of mandibular posterior teeth contact areas from occlusal view. So these contact areas are slightly facial to line that divides tooth in a half from a facio-lingual perspective, and this mandibular molar contact area locates slightly more facial than their maxillary counterparts. So again we are bisecting this teeth in the midline. So this is your facial aspect and this one is your lingual aspect. So in this image you can see this is present in a middle third but slightly towards the facial side, right? Again same thing here as well. So these are more facial than maxillary molars. Now moving to this image from our textbook. So in this image, this is for maxillary teeth and these are for mandibular teeth. In this maxillary anterior teeth, the contact areas are present at middle 1/3, slightly towards the facial aspect, right, in the posterior teeth. But in mandibular teeth, they are present in middle 1/3 and more facial than maxillary posterior teeth, right? Now moving to age related changes. So what happens in younger teeth? This contact are as a point, but with the age advance, this contact become contact area, right? So the contact points broaden to contact areas, right? Then proximal surfaces become broader with age. So with the age advances, this occlusal surface of teeth will be flattened. It will be going to look like something this, right? The flattened teeth. And with the time, this proximal surface will become a whole contact area, right? It means no such a contact point or a contact area. The whole proximal surfaces of both the teeth will contact with each other. Next, in bruxism, which is clenching of teeth, this causes the flat contact areas. So in this picture, you can see there is no presence of contact areas, right? It is become a flattened over here because of bruxism, right? Now, how will you going to clean this contact areas? Because toothbrush and toothpaste cannot clean this contact areas. So, we are using a daily floss to clean this contact area to prevent infection. So, proximal cleaning essential for gums and oral health. Flossing is the primary method, or I can say only method to clean these contact areas and prevent infections, gingivitis and periodontitis, right? So this was all about today's session. Thank you so much for patience listening. If you have any doubt related to this, let me know in comment section. I will definitely respond you. Thank you so much.